Senator Sanders.
Thank you all very much for being here. One of the concerns that I have in terms of where we are now and where we might be in the future is that the American people do not have ready access to the information they need as to how they can receive the best treatment available for COVID. An example, a 60-year-old gentleman wakes up in the morning, has bad symptoms, tests positive for COVID. I worry that that person, and millions of them, may not even know that there are therapeutics out there that can help them, that they may have 5 days, only 5, they have to take it within the first 5 days of symptoms. Can you tell us, Dr. Walensky, what we can do to make it easier for people to get the therapeutics that they need?
Thank you, Senator Sanders. This is key in terms of our distributing and equitably distributing not only our therapeutics, but in fact, even before our therapeutics, communities and at-risk people need to understand to do a test, because that's the gateway into getting these therapeutics. So we need to have testing available, accessible, a lot of what the ASPR has done in distributing home tests. We need to have therapeutics available in at-risk communities across the country, and then we need to do public health campaigns so that people understand that a test should be done and that they have access to these therapeutics.
All right, but the concern is that in some of them, at least, you should take the drug within the first 5 days. Are you confident that we have a system that if somebody wakes up, they're going to have to get a prescription from a doctor? Do they have a doctor that they can get a prescription from within the first few days? Do they know where to get the drug? And do they have the money to pay for that drug?
So the drugs are free, the tests are free, but I'm not sure that everybody knows that. And we have expanded our rollout and accessibility of Paxlovid, but I will also say that just like early in our vaccine work, we have seen inequities in how that Paxlovid has been used. We'll have more data forthcoming from the CDC soon on that, but we have a lot of work to do in the equitable distribution of Paxlovid and to getting the education to the communities, to community health centers, to physicians in rural areas.
All right. Should our goal be, it seems to me, to make it nice and simple, that if somebody is feeling ill, if somebody has COVID, they can dial a 1-800 number and get the drug as quickly as possible. Is that the goal that we're striving for?
Yes, we need to do that under the EUA and with the caveats that there are some things like renal insufficiency or drug-drug interactions that need to be assessed, so we need to make sure that those assessments are complete as well.
All right, I want to change course a little bit here. And touch on a subject that I don't think we talk about enough as a nation, and that is that we have a significant shortage of doctors, nurses, pharmacists, dentists, other healthcare providers, and that shortage has only been exacerbated as a result of burnout related to COVID. I know that's not necessarily within your jurisdiction, but can you give us some thoughts about how serious that shortage of medical personnel is and what we might want to do to address it?
Yes, I think it's key, not only medical personnel, but public health personnel. A de Beaumont Foundation survey demonstrated that we are about 80,000 public health workers in deficit right now, and that we need to not only retain the ones who have stepped up to the plate during the COVID-19 pandemic, but we need to foster and invest in future public health workers as well as healthcare workers. And that includes loan repayment, it includes investing in the time and making sure we're competitive from a salary standpoint so that we can retain the best of the best in these fields.
Okay, let me ask Dr. Califf a question. Senator Paul raised the issue about money and so forth. And I look at it, his questions are valid, but I look at it a slightly different way. I am concerned, and you correct me if I'm wrong here, Moderna, who helped create one of the important vaccines that is saving lives, received, as I recall, about $2.5 billion, I think, during the Trump administration. My understanding, and you correct me if I am wrong, is that the gentleman who is the head or was the head of Moderna recently received a golden parachute of some $800 million. $2.5 billion of federal funding to develop the drug. Moderna makes huge amounts of money. This guy receives $800 million in golden parachute. Am I right about that?
I am not aware of that. It's not something I would keep up with, particularly in this job.
Not something you would keep up with. The head of the Food and Drug Administration, you would not be concerned that a guy, when we're trying to get vaccines out to people, I'm corrected, it's a $926 million golden parachute. If that's true, if the federal government gives a company $2.5 billion, and short time later, the head of the company gets a $900 million golden parachute, that is not a concern to you?
No, I didn't say it was not a concern. I said it's not something I keep up with in daily life. What I'm very concerned about is the equitable distribution of vaccines that save lives and antivirals that save lives, and we're not reaching the goals that we need at this
Well,
point.
maybe, I think I would hope everybody agrees that we need the financial resources to make sure that everybody has the vaccines. But if one guy ends up with $900 million, rather than using that money to get out the medicine we need, the vaccines we need out to the people, doesn't make a whole lot of sense to me. Thank you very much, Madam Chair.
Senator Romney.
Thank you, Madam Chair. Senator Sanders, I'm one of those that